Hi, I'm Katherine Sanderson, and I'm the author of a new textbook with Sage on health psychology. I am really delighted with this third edition of the book, and I had two major goals in writing this. One, I wanted to make sure that students really understand the research underlying the field of health psychology. And I've worked very hard to make sure that there are research examples throughout the book that are intriguing and interesting to students. Many students think of research as the boring part of psychology, and so I've tried to come up with examples to help them understand that this is actually the most exciting and interesting part of the whole field. So I talk about the impact of concussions on lasting influences on functioning, on psychological and physical well-being. I talk about current public events. So Charlie Sheen's diagnosis with HIV and that publicity led to massive increases in internet searches on HIV testing, which may in fact have led to lives being saved. I also have tried to talk about specific research examples that will appeal to students. So I talk about the ways to decrease the opioid epidemic and what are factors that cause it. I've talked about research on how delaying the start time of schools so that teenagers are less sleep deprived actually results in lower rates of accidents. My second goal in writing the book was to make sure that the writing style was interesting and engaging. And I've worked throughout the book in trying to come up with vivid photographs that describe current events, things like Prince's overdose death, for example, Brittany Maynard's decision to end her own life after diagnosis with cancer. So I've tried to come up with examples throughout to appeal to students in the photographs, in the research examples, to make sure that the book is interesting and exciting to read. And I'd be glad to answer any questions that anyone has. Please contact me at any time. And thanks so much for your help in marketing the book.
Catherine's two goals for the book are for students to understand the research underlining the field of health psychology. She also wanted to make sure that the writing style was interesting and engaging. At the higher end of the market is Catherine's book. You may recall this is a pickup from Wiley and has been revised to introduce the scientific story of health psychology, to engage students with links between the science and their own worlds. You will want to ask discovery questions about students' understanding of research in health psychology and how students make connections between research and real life. The timing of Sanderson and Gurung's new editions opens up lots of opportunity because most of the competition has been updated recently. The competition breaks down by its perspective and level, social and lower level to biological and higher level. Target Brannon, Reagan, and Taylor with Gurung. They have similar biopsychosocial coverage. Taylor is Gurung's most direct competitor. Here's an exception to keep in mind. If an instructor is using Brannon for its biological coverage, you will want to lead with Sanderson. Target Serafino and Straub with Sanderson. These books cover the basics through the hard science. Straub's comprehensive biopsychosocial approach is a direct competitor for Sanderson. The fourth quarter is a short selling season. To make the most impact, be sure when calling on health psychology opportunities to use your discovery questions and show the table of contents to help guide you to the best solution. Hey, Laura, how many psychologists does it take to change a light bulb?
I don't know how many.
One, but the light bulb really has to want to change.